Welcome back to the Health Revival Show. Today we have Dr. Malisa Carullo. She is the Senior Manager of Medical Information and Safety at one of my favorite supplement companies, Metagenics. And so we're going to chat today a little bit non-traditional interview, just rapid fire questions for her. She is a wealth of knowledge and her zone of genius we want to share with you. And then we're going to get into some underrated, overrated things because we know the world of Instagram and TikTok. There's so many misleading things, let's say that, that makes you think you should buy every single supplement known to man. And the reality is, some of them you may not need. So, welcome to the show.
Right.
Let's just
Thanks.
have you introduce yourself to our listeners. And how did you land in this position at Metagenics?
Yeah. Okay. Well, first of all, thanks for having me. I also love Metagenics, so I was really glad to hear that. How did I land this awesome position? I don't know. I just found I'm just really fortunate. At the time, they were hiring a sales rep, so I actually started as a sales rep for Metagenics, and I did that for about 3 years. But being that I'm a naturopathic doctor, um, and I still practice part time on the side, I moved into this medical information role, which is our clinical team. So I run our clinical team and our safety division at Metagenics, and yeah, I'm going on my 11th year there, and it's everything I could ask for. It's just a dream come true. I get to talk about all the great things our medicine could do day in and day out, and then just also just see that it changed lives, right? Which is amazing.
Is amazing. So, when you say you run the clinical team, do you help formulate the things that are brought to market, or what does that role look like?
Yeah, so it's not part of my role, but they very much come to me for advice. Like, how does this look from like a practitioner standpoint? Would this be something you would incorporate? Being that our role on our team is just to talk to practitioners every day, so practitioners across North America, Canada, the US can call in and chat with someone on our team about a protocol, maybe a product that they saw that they want to incorporate, but they don't know how. Maybe they're using a protocol that's not quite giving them the results they're hoping for. So this is just something that is free to all our accounts. Practitioners across North America call in, chat with us. It's something that I think that a lot of practitioners actually pay good money for every month that we're offering for free. So it is something that like really makes us stand out across the competitors.
No, I mean, across all brands, we use a number of different brands, but Metagenics is probably top in terms of the vast level of supports that you guys have and the accuracy of what they provide. And it's just,
Yeah,
we always say that the supplement industry is kind of a wild west out there, and you know,
absolutely.
third party testing and regulations and what they say is in it versus what is actually in it. um you aren't always getting what you think you're getting. And so
Absolutely.
it's thank you for being part of a brand that is obviously a very well ran and effective and supportive brand out there. So I know we want to dive into a lot about gut health today. I would love to, though, a lot of people that we talk to, ourselves included, get into this space because of our own story, and kind of our own journey and our own experiences. So is there a reason that you dove into naturopathic medicine, and was it you, was it someone else?
Yeah, interesting. Honestly, I don't have a cool story like everyone else. I for most of
It's
my
really smart.
no, I don't even think it's that. It's like for
I
most
think
of my life, just wanted to be a dentist actually. So, if you or anyone out there has heard me chat before, I probably will chat a lot, and it might even come up today. Um, like how everything with the gut will be referenced back to the mouth, and I talk about the teeth a lot, and anything that's happening up here in the top half here. So I want to be a dentist for the longest time. I was doing my master's in genetics and molecular evolution, and I was applying to dental school, and I don't know what came over me. Honestly, it was just like a total 180, and I was like, I don't know if I want to do this. And as I started looking like online, like searching the internet, I knew about naturopathic medicine. It's pretty popular in Canada. Um, but I don't think I really understood what they did. And so the more I looked into it, I'm like, I think this is for me. Like, I think I'm going to do this. And I come from a pretty traditional Italian family. So my parents were not pleased at first. I think that, like, obviously looking back, they're this is where I'm supposed to be. Everything's worked out really well. But at first, they were just like, "What is it? Kind of like witch doctoring? What are you thinking right now?" So I definitely took some heat for it. But yeah, not a cool health story, which is, I guess, good in a way, um, and not how everyone, is leaded towards naturopathic medicine. But that's my story.
And I mean, I kind of like it seems like there was a divine intervention that happened, and
100%.
for whatever reason, you felt in your gut and in your heart that it wasn't the right route, and here you are doing
100%.
amazing things for an amazing company. So let's start off with this question because I think Liz and I both on our social medias get, if there was one thing that you would recommend, like if there was one product,
Yeah.
um, let's specify a little bit down to gut health. What would that product be?
Okay, so you're just starting this off with a banger, right? So there's too many to choose from, really. But as we chat, I think you're going to notice that typically I will gravitate towards formulas that are going to have multiple ingredients that are going to act on different pathways in the body. So I'm going to choose things that we can hit multiple things at once. I'm not really like a one ingredient or a two ingredient formula girl. So for gut health, I'm thinking of a medical food in particular. So Ultra GI Replenish. And this is going to be designed to address like malabsorption or any like compromised gut function diagnoses. So in addition to any macro micronutrients that are in there, there's ingredients that are going to, let's see, like support metabolic processes, support just like gut integrity and the gut lining, strengthen that intestinal lining, and then promote like mucosal healing. So there's prebiotic fibers, a multitude of amino acids, and we're just trying to like foster a really good gut microbiome. So you can see why that sounds amazing. There's just so many things happening with it. And that's what I like, because over time, individuals are going to just get really tired of taking multiple formulas. So this is a nice option for them.
Yeah, I love one of the things that you mentioned there that could really apply to anyone, and I think in any phase of gut healing, and that is deficiencies. So I always am talking about like it's one thing to ingest a good diet, and most people think they do better at this than they actually do. And I'll also say
Yeah,
myself included, like getting 30,
100%.
40 grams of fiber a day, you got to be pretty intentional with that. And then if you're trying,
Yeah,
so I love that you brought in that this is a multifaceted support that is giving you the gut lining, because I'm always talking about too gut lining support because we are exposed to so many toxins. But then with that particular product helping fill the gaps, and if somebody has, let's say, low stomach acid, which we'll talk about like what the symptoms might be too, then we know this is a way for them to get nourished with some of those vitamins and minerals without
totally.
having maybe digestive backlash. So just for everyone listening, she said um, GI Replenish, which is a medical food. Can you explain a little bit about that term, medical food? Because I think
Sure.
Metagenics has several we love and use, but people are always like, well, what's
Great.
the difference between my whey protein from Costco and this product?
Yeah. So medical foods, they're different than functional foods. So metagenics will have functional foods as well, which are other types of protein powders. But a medical food is a formula that has been specifically designed to support a condition or a diagnosis of some sort. And there has to be research supporting the ingredients that are in the formula for that disease state or condition. So in this case, it's malabsorption or some kind of like functional GI condition. And so this is a special like category regulated by the FDA. If that, the list of the safe ingredients changes by the FDA and it's in one of the formulas that's a medical food, we would have to, or the individuals at Medgenix would have to change that ingredient formula as well. So it's very much dependent on like what they deem is necessary or safe for that disease state or condition. But I think importantly, like it has to have some research supporting like that ingredient, whether it be a vitamin, a mineral, anything from a natural source supporting that disease state or condition. So that's very important.
Yeah. We use Ultra Clear often for our cleanse phase where we take clients through like extreme detoxification supports and really kind of push in the liver and Ultra Inflam X, obviously, if there's a really inflammatory situation. And
Yeah.
there's so many that we love and use with our clients and recommend on our social medias because, like you said, one, taking lots and lots of supplements becomes really tiring and
Yes.
expensive. And medical foods, some people can't swallow capsules.
Yes.
Medical foods can also be dosed very, very slowly. One thing that I noticed with the Ultra GI Replenish is some people get bloating from it right away, right? Like if you take a full dose of it, you may experience some bloating as there's a repopulation going on and a restructuring of the microbiome. And so being able to
Yes.
be like, oh, I can take a tablespoon of it versus the serving size is one capsule. I can't break that one capsule down potentially. And so that's another thing that we just love about medical foods, and the Ultra GI Replenish is a great support. So okay, on the topic obviously of supplements, a few big ones that I know Liz probably gets a little bit more than I do, but I even get a ton. Heartburn and reflux,
Mhm.
bloating, and irregular bowels. Those are kind of like three big top GI complaints.
Yeah.
Um, and I'll get them obviously because GI obviously leads to hormone issues. But would love to hear your thoughts on where you go when someone, reflux is a main issue and has been bloating, irregular bowels, like obviously three different categories here, but what are your initial thoughts?
Okay. Lots of things going through my head right now. So heartburn, reflux, we could start there. So a supplement that I like for that would be, well, there's a few of them. I'll say glutagenics first. So glutagenics is a combination of deglycerized licorice, L-glutamine, and aloe. So the idea is really to soothe and support, again, the integrity of the gut lining, but then also just reduce inflammation and irritation that might be caused by the chronic acid exposure. So again, like deglycerized licorice is just a really nice ingredient because of this like gentle, like soothing approach it has. So it takes down inflammation like really slowly and gently. And glutagenics is amazing. I've seen it do some remarkable things in a small amount of time. Especially for individuals with like Crohn's, ulcerative colitis, it's a great formula. But we also at Metagenics have zinc carnosine complex. So zinc carnosine is going to help also like just promote this mucosal healing and enhance that like protective barrier of the stomach lining. So zinc acts like the shuttle bus, taking that carnosine like over that barrier, so it can help where it's needed with the cells and replenish the cells and make them like plump and juicy again instead of like flat pancakes that can't really function very well for us. So I like those two for sure. um and then I guess it's another story if someone's on like acid blockers or
Sure.
protein pump inhibitors of some sort. Like there's some other things we could do like replenish bees, but I think glutagenics, zinc carnosine complex for heartburn or
Could you
reflux.
Could you expand a little bit more? Because I know I've gotten this. I have a lot of people who will wean off proton pump inhibitors. And, we're talking about why zinc carnosine specifically is so important to nourishing and soothing, the microbiome, the tissue there, and then also being able to rebuild our stomach acid because it does play a big role, just like B vitamins. But some people will say, well, I can get zinc at Whole Foods for $12. This zinc product is much more expensive, and the formula you have there, can you just elaborate a little bit why that is specific to these upper GI issues and healing?
Yeah, it's more about like the carnosine as well, though. So it's the zinc like shuttling it over, so that it could be used in that specific area. Zinc is often deficient in a lot of us, like a lot of other vitamins and minerals. But if we take zinc in, it will more than likely be used up by our immune system over other areas of the body where we need it. Um, and so when it's attached to carnosine, and there's other variations for different areas we use in the body, we could basically ensure it's going towards the you know upper lining and supporting that area for these individuals, because otherwise we're really not going to get the stimulation of that natural acid later on if our cells aren't working correctly. um, is that the answer you're looking for, maybe
Yeah,
along that line?
because again,
Yeah,
there's
cool.
the zinc. Same thing with things like iron, right? Or even B vitamins. There's many
Yeah,
different types. People hear that buzzword and they're like, oh, I'm going to grab some zinc from Amazon and don't realize that's not really doing me much benefit. I really need to have the zinc L-carnosine in this case. Okay. So I know we
for sure.
have a really big question here. So next category was bloating and food reactions. We know this is a big
Okay.
one for a lot of people.
Yeah, that's a big one. Yeah, but it's very valuable, right? So, like bloating as a symptom is very valuable because it can help us or try and help us like determine or pinpoint like where is that digestive support needed. So, if bloating is going to occur like soon after we eat, that may indicate, low stomach acid. And then like low stomach acid is meaning that we're not breaking down food early in that process. So soon after we take it in. And so supplement, are we asking supplement? So the supplement here would be spectrazyme, betaine, HCl, and pepsin. So it's to replenish betaine, HCl, and pepsin. So some of those like um, to help with acid production once again. If bloating starts, like an hour or two after a meal, that's suggestive of uh, needing support a little lower in that digestive process, right? So that could be digestive enzymes that would be coming from the pancreas. So I would use something like Spectrazyme Complete or Spectrazyme Pan Extra Strength. So Pan being short form for pancreas. So those are enzymes that are going to break down macronutrients, so like proteins, carbs, and fats. And then if bloating worsens after eating high fat meals, um, this is where I might go on a little bit of a rant here, but this is the need for bile support. And I might rant because I think this is often one that's missed by practitioners or forgotten about. So, Lipogen by Metagenics is just one of those oldie but goodies. It's a really targeted formula. It's containing ingredients that are going to be used for fat emulsification and gallbladder stimulation. And this is different than like an ox bile formula, which I think is quite common as well. Lipogen is really supporting bile production and liver metabolism. Ox bile is just going to provide this immediate bile replacement so we could break down fats in our body. But this becomes very, very important for especially women. You know, I'm 41. So, like 40 and over, we're starting to see like declining estrogen, whether we believe it's happening or not. And that in itself reduces bile production and flow. So, this will lead to like sluggish digestion of fats, bloating, increased risk of gallstones. And like this is common. We see this very, very often in practice, and I think it's often missed. So supporting this like bile production overall and liver detoxification can really just improve digestion comfort and then also like metabolic health in this population. So yeah, sorry for the rant, but there's different stages of obviously digestion, and
You're speaking
as
our
it takes
language.
more time, yes, great. As we go further down or more time passes, that might be indicative of like lower in the process of needing support. But don't forget about the gallbladder and the liver because that's key for a lot of cases.
Yes. Yeah, I was reading through a PDF today and it was talking about hormones and supporting of hormones, and the bottom line said liver, 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 liver. Like it's so
And gallbladder. Yeah, exactly.
overlooked when it
Yeah,
comes to
totally.
especially that age range. And we know with digestion, I think a lot of people just immediately think gut with digestion, and it's
Yeah.
very often up, liver gallbladder dysfunction that is then driving further gut dysfunction. It's all we know in the natural world, it's all connected. Um,
Yeah.
so another thing we often see, and speaking of bile, constipation. So,
Okay.
irregular bowels, constipation, straining, not fully emptying, not going every day with ease. Where would you start in terms of support, in terms of maybe, dietary?
Yeah. So irregular bowel movements of any sort, if we're like, moving towards more constipation, because I think you're right. Like there's definitely individuals who will like, sway both sides, but constipation is quite common. So what we're seeing is that the body's just natural rhythm is out of sync, right? So this may stem from like just hydration, low fluid intake, electrolytes, but also low fiber, could be sluggish bile flow, poor enzyme production, everything we just chatted about. Um, it could be any one of those. I think that if we see like constipation with a few other things happening, like dysbiosis, or perhaps they have a diagnosis of SIBO, this could like further disrupt motility, right? So this just adds to like the complexity of the story. But when I think of constipation, I think about the nervous system in particular. I think about like the pelvic floor dysfunction. I try to do like a lot of structure function anatomy stuff because it helps a lot. And I think this is where integrative medicine is like the coolest and really shines because like if we think about also just neurotransmitters like serotonin, they're produced in the gut, right? So imbalances are not only going to affect like the mood and the brain function, but also gut motility, highlighting that importance of that rhythm, that gut brain connection. So long-winded answer to say supporting regularity typically is going to involve like this approach, this holistic approach to optimizing hydration, fiber, digestive enzymes, support the nervous system, and then like microbial balance or like the environment that they can thrive in, the bacteria can live in. So a few options. So metafiber is a nice option. This is just like an insoluble fiber um, formula that's going to help with like transit time and regularity. If it's something that's like a little bit more complex, we think there's differing like variables that are contributing, then I like GI support. This was formerly known as endorphin, another oldie but goodie, but this contains ingredients that are going to like discourage adherence of like bad bacteria to um, like sticking around to the walls of the intestine, add bulk for regularity. And there's just like, again, a whole slew of different ingredients that would support this, like arabinogalactans, prebiotic fiber, cinnamon for blood sugar regulation, help support the metabolism, green tea extract, uh, non caffeinated for antioxidant support. So it's amazing, this multi ingredient approach. Um, I'm actually not sure it helped the listeners at all there. So we're going to think fiber, but if there's other things like contributing factors going on, I think that we just need to investigate a little bit more because it could be other things. Water, electrolytes, bacteria are missing, etc.
No, I think that's very helpful. And again, one thing Becca and I do talk a lot about is the foundations because so many people want to
Yes.
take a fiber supplement. Well, if you put fiber in, whether it's a supplemental form or a bunch of raspberries, and you don't have hydration, you're going to make your situation worse, right? Like things are not going to move through the way that we want to. So I think the foundation calling that out is very important. And then we would 100% echo and agree with you on the fact that the liver gallbladder plays a huge role, especially when we think about
Yeah.
bile circulating to the small intestine and food moving through and not having bacteria get into parts of our colon that we don't want it. So I think those are all very helpful. One of the next questions I would love to talk about, because I think this goes hand in hand with what you just mentioned in terms of bacteria, right? If someone
Mhm.
doesn't have a stool test, they suspect because of Dr. Google that they have SIBO, right? And so they're self diagnosing themselves maybe with that because they're bloated all day, every day, worse at the end of the day. And then they see the next ad on Instagram about a probiotic and they try it and it gets worse, right? Or they're someone
Yeah.
who's prone to histamine issues and they buy this probiotic. I'm not going to name big brands out there that do massive amounts of advertising, but there's some that are available on the stores of, on the shelves at most big stores too. And I just get asked about this all the time. So I'd love for you to talk a little bit about this. Like probiotics, I know one amazing thing about Metagenics from clinical practice and also working with you guys is that you are very intentional about speaking to the strain specific,
Yes.
condition. So, what are your thoughts here? Should everyone be taking a probiotic? And if they should, what's maybe the safest for general health?
Okay, so I do think everyone should take a probiotic. I think that we've like even just as far as or as long as I've been at Metagenics, the research in this area has evolved so much, and it continues to evolve. And I won't go down that rabbit hole, but essentially, I do think everyone should take one every day. I think that if possible, a probiotic that has multiple strains is very important. The more strains means that there's more diversity. More diversity means we just have like this ecosystem or this environment where there's a lot of variety, and that's always good for digestion in general. So, something like ultrafluorous spectrum would be a really good probiotic. I know Metagenics obviously has a lot of probiotics, so it could be quite overwhelming even for practitioners to try and decide like which one's best for my patient in this case. So I don't really think you could go wrong as long as there is strain specificity there. I think something we've learned about diversity is that we could just trial different ones, see how we feel, because it's not a one probi is going to fit every scenario. And to the point of diversity, switching it up once in a while is really important. But like Lizzie made a great point, is it's that strain specificity is the key there. Without the strain being noted, typically it means that there's no research supporting that probiotic or that strain. And even sometimes there's strains listed that seem arbitrary, and when we look them up on research databases, there's not a lot of information supporting them. So those are just some things to look for: strain specificity, no strain, no research. If there is a strain, like, does it have some good human clinical supporting its use in whatever condition or disease state that it's touting it's good for.
Okay. So you mentioned diversity there too. Can you explain, like,
Mhm.
how often do you think someone should change their probiotic? Every month, every 3 months? What would you recommend?
Yeah, I don't think that there's, like a hardcore anything to follow, but a couple times a year, I think that some probiotics like Ultra4 Spectrum has 7 strains, I believe, in it, which is amazing, right? I don't know if there is a need to switch that, right? Like, I think we're already getting a lot of the common strains in there. But maybe like once or twice a year would be great. I know like sometimes I'm at trade shows and there's some on the counter. So I'm like, okay, I'll take a bunch of these and like just put that into my regimen for like a couple weeks, which is in itself just different and good, right? But I think the other point is, as we talk about this, to realize that it's not just about diversity of the strain either. As we learn more, like where it's at is really prebiotic fibers, and chances are we'll get to that at some point while we chat today. But prebiotic fibers are also important in the different foods we eat, because it's kind of like the food for the probiotics, and what they create from there is what's important body wide. Um, so I'm not sure where we want to go with this, probably in so many different directions. So I'll wait to get a cue from you.
Yeah. I mean, I think you brought up a great point there. Like, I use the Ultra Flora Synergy as kind of a nice, hey, you're offboarding from our program now, because it does have the pre and probiotics in there. And what
Yes.
I find for many people is that they do a disservice if they're, again, not really religious about prebiotic foods, taking and spending
Right.
money on, I mean, let's say $45 for a bottle of a probiotic, but then I'm not eating adequate amounts of prebiotics. Therefore, I'm most likely not getting the most benefit from it. Right. And then, just while we're here, if you could talk on quality, because what sets apart a probiotic that I'm spending 50, 60, $70 for, to the one that's on the shelf at Target that's now on clearance for $7, you know?
Yeah. So I can't speak to other companies, but I can speak to what Metagenics does to ensure the quality. Um, and so for probiotics that Metagenics sells, all of them except one, I think two. So all of them except two are human strain probiotics. The other two have soil-based probiotics in them, which are a different story. But for those that are human strain, and most likely, like what we're talking about with competitor-wise, is human strain microorganisms as well. They're just very sensitive to heat, right? So they are typically really hard to keep in a capsule alive in order for, like, when we digest them, to go through stomach acid. Hopefully, fingers crossed, we have enough there. Stomach acid, bile, all of these conditions. It's hard to keep them alive and get to the place they need to be so that they could be activated out of the capsule and do the job that we need them to do. So in order to like ensure this is happening, that we have these quality live microorganisms, they are basically encapsulated or powdered in this dries freed condition, meaning they're kind of like asleep, they're laying dormant until they reach, the right location, and then they awake and do their job. To be able to make sure that again that's happening, there's quality testing, and for long periods of time, like upwards of like over 12 months, in some cases like 24 months, following the life cycle, the duration, the amount, like how much of this probiotic strain do we need to ensure that enough of it is getting to the area we need it to get to become alive and do the job it needs to. We also have to look at the research, right? And like try and mimic the research on what the therapeutic dose is. So, for lack of like long description here, like most probiotics need to be shipped with a little bit extra in there so that they reach like their expiration date and they're still viable. And that's something that's important to look for. And Metagenics definitely stands by that, the expiration date, right? We ensure that there's going to be this viability of the microorganisms through to that date of expiration. So they're going to be alive, good for use until that date, versus other competitors. They'll only guarantee not till, they're going to guarantee at date of manufacturing. So that's completely different. So if we just think about those companies to be able to like follow life cycle of a certain colony forming unit for like 24 months, like that's a lot of work to do that. Like that's quite the commitment, to be able to ensure like these are viable.
It's a lot of testing and a lot of, figuring out how to make things work. And I have a feeling that not all companies are doing that. And their due diligence, because also from what I understand, like that's also a big investment to have, you know other companies come and monitor your products, and it's not just your word saying, this is what's
Right.
in the product. It's outside regulation that's coming in
Absolutely.
to make sure that there is, viability to what you're claiming. And not a lot of companies will always do that. So
Correct.
yeah, it's a lot more than just this is what is in it and here's the bottle, and you know so I know, talking about prebiotic fibers, but switch a little bit to immunoglobulins, because immunoglobulins are something that, when you are dealing with years of either antibiotic use or, a really weakened overall system, an immune system that's not very resilient. um
Yeah.
I know immunoglobulins don't always create like the biggest wave in terms of symptom relief, for everyone, but the importance of them, and what ultimately they are doing for the system, and where you see them benefit people the most.
Yeah, I think like Liz and I chatted about this maybe a month ago now, but because Metagenics has a couple of formulas with immunoglobulins in them, and again, another oldie but goodie they're kind of forgotten about. Um, So let me try and explain why immunoglobulins are super cool. So they're special proteins, and they're going to act like the body's like surveillance system, or this like personal like security team. So they're going to help neutralize harmful invaders like toxins, bacteria, viruses, especially in the gut. Um, and so like even though you might not feel them working right away, you would like when we talked about digestive enzymes with bloating, like we often feel relief from digestive enzyme use right away. We're not going to probably feel that with immunoglobulins. They're very quietly doing their work, like very much behind the scenes, and they're trying to strengthen our gut lining and our immune defenses. So I'm trying to think of a good analogy. So let me think here. Like if we think about the security guard, the gatekeeper kind of analogy, and I think we've heard this before, but I think it's super true for immunoglobulins because um, when it's strong and sealed, you know, it kind of decides what gets into our body and what gets kicked out. So if our gut barrier becomes leaky, if toxins are able to get through, or undigested food particles can sneak through, they can trigger inflammation, immune reaction. Immunoglobulins are going to like constantly keep that barrier sealed. They're going to bind anything unwanted and like safely and very quietly, like escort it out, right? Before there's any trouble being made or any like commotion, they're just gonna be like, I think we need you to leave now. So they're silently asking people these like toxins to leave our gut or leave the room. So even if we don't feel a big change, they're definitely helping because they're supporting this like long-term balance. It's more about like this foundation type of support, right? Like less of a quick symptom relief and more about setting that stage for lasting gut and immune health.
I think that's a great analogy. It's kind of like you have no problems at a club if the bouncers, quietly escort
Yeah,
people out. But when a fight breaks out and everybody like decides to pound,
exactly.
and partake, you got a big problem. And I was just,
Right.
I was filming some reels this morning on like our complement system and our complement genes, and then our
Yeah.
interleukin genes as well. And so for people who struggle with, little things flaring them and they can't calm it down, it's like, hey, we also want to look at your genetics. And a big thing
Yeah.
I find for a lot of my gals who have reoccurring issues with maybe SIBO or, pathogens or parasites, they can never get their immune system kind of back balanced. Keeping that support in long term is very helpful. And again, like you're saying, it's more of the gatekeeper, the silent person here in the background doing things, but you'll notice if you don't have it on board how quickly you might start to flare, whether it's a toxin or a bacteria or whatever. So I liked that analogy. I think it's great. As we start to wrap up here, I would love to just talk a little bit about kiddos. My child yesterday ate
Okay.
ate. So we ran out of our the multivitamin, the Metagenics. I call it his grape
Yeah.
starburst every day, but his multivitamin.
Yeah, no kids. Totally like that.
Yes, the
Yeah.
Medicaid multi. He ate 3 of them, and I
Mhm.
was like, "Marcus, these are not, like, just gummy bears that you can eat," I was like, "I hope you don't get an upset stomach." But anyways, I'd love to talk a little bit about, just kiddos and the line that you have all
Sure.
created. Marcus loves those and the DHA. They taste like bubble gum, and so just first, I would say thank you for making a good quality product that tastes good for our kiddos. But let's talk a little bit about what I see so frequently, and that is kids that are struggling with deficiencies, and a lot of that being related to I'm a picky eater. And how maybe we could support them, because I'm sure you've done a lot of research in this area in your job now. And then maybe what are your top recommendations if you do have a picky eater in terms of trying to get a little bit more good in?
Yeah, so I won't chat about like, before baby's even born, but like a lot of the research points towards like what mom is eating and like how healthy or um how much does she incorporate like a variety of phytonutrients, get her foundation nutrition, blah, blah, blah. So a lot of that will help and contribute to hopefully having not like so much of a picky eater or picky eating child. But we won't chat about that. We can just chat about the kiddos. So I think this is a good area where supplements thrive because supplements are just that, right? Like they're supposed to be supplemental and not take the place of diet. So if we have a kiddo that is picky or depending on like the developmental phase they're in, it might just be, worse than other times. But we want to use supplements here for a bridge. It's a helpful bridge, especially when the diet is going to lack like certain nutrients, because that's what we're afraid of, right? In that developmental process, they're not going to have enough of the vitamins or minerals or whatever nutrition we need to help them grow and develop. So you mentioned Medicaid's multi. I think that's amazing, especially useful for certain things that they're going to be most efficient in, which are iron, zinc, B vitamins, vitamin D. They're often low in selective eaters. The Medicaid's DHA, as you mentioned. So, very, very important for development of the brain, focus, mood. And I want to comment on there too, because I have no explanation for this, no clue. Like maybe one of you gals can actually help me if you know anything of like the research surrounding it. But I'm always amazed to see like as parents incorporate like some of these formulas, like even like the earlier they incorporate it, how much more the kid is prone to like stay on it. So if I see if we incorporate it a little like later, like, they're like 8 or 9 years old, it might not taste delicious to them, but like early on, they love it. It's like they crave it. I mean, I have a niece that's 15 and she still asks for like the DHA chewies. Like, I mean, they're not awful for like a supplement, but let's be serious. Like they're chewing fish oil caps. So, I mean, they are what they are, right? Like it's not like my go to, but it's just something that they crave. And I just think that is amazing. It's mind blowing to me. So, anyways, other than that, there's MetaKids nutrition powder, and this could be really good because it's nutrient dense. You can use it like for smoothies. It's going to have macros like protein, but then also micro like vitamins, minerals, phytonutrients. So a really good kid friendly formula.
I love all of it. And I think, a big part of it too is seeing your parents doing things and wanting to emulate and replicate what they're seeing. Um, my daughter's,
Sure.
my daughter's like, I want that smoothie. I want when I make one, or I want the yogurt that you made. And so I do a lot of times make her a small version of mine and add the Meta Kid stuff in it,
Awesome.
or
Yeah.
a little bit of protein powder or whatever it might be. I have another child, my son, who did not replicate at all what I do and has not eaten many vegetables in his entire life, and he's 6. So he is someone that I use a lot of the different types of supports so that I
Yeah.
can try and be a little bit more well rounded with his diet. Because yeah, it didn't seem to rub off on him. Um, but okay, as we kind of round this out, let's do a quick like overrated, underrated chat on some of the big ones out there. Okay,
Okay.
so multivitamins.
Let me go first. Okay. um, I think it's underrated. So I think I want to preface this little like quick round with I'm talking about high quality supplements in every one of these instances. So like a high quality multivitamin like Phyto Multi, I think is super underrated. Um, I think it goes beyond covering like these basic nutrient gaps. Like there's just a tremendous amount of research supporting this formula for like advanced cellular protection, immune health, anti-aging. It can combat oxidative stress. I literally think every human should be on this multivitamin. So it's science backed. It's amazing foundation support, but also like defending the body's from invaders. Like it is amazing. So underrated for Phytomulti. The others, I'm not sure. Maybe overrated.
Okay. So I think we already covered the probiotic, right? You would say that's appropriately rated, maybe because so many people get
Yeah.
advertisements for it, and we just want to make sure there's a good quality and that you feel good with it.
And
Um,
strains. Yeah, and strain specificity.
yes.
Yeah.
Okay. Colostrum.
Yeah. So colostrum, I don't know, we'll say underrated. I think underrated because this is going to contain those immunoglobulins. Like there's definitely other formulas that would contain immunoglobulins as well. Um, and help with building like this immune system through the microbiome. So yeah, all as I think about it and talk about, it's underrated. We should support that a little bit more. So yeah, underrated. I think it's a wicked immune modulating formula and compound. So yeah,
Okay. Can we just add
Vitamin.
here that, sorry, Becca, go ahead.
No, you're good.
yeah,
Finish out your thought.
I was just going to say, let's add here that immunoglobulins are dairy free colostrum. So if you're listening to this,
sure, yeah,
hey, I want the benefits. Colostrum is amazing, but if there's a dairy sensitivity or lactose intolerance, you want to use the immunoglobulins. Otherwise, I think in the world of, looking at the supplements, it's called immunolin, is what I have found to be the dairy free one. Okay, vitamin D.
yeah. Vitamin D. I think I'm still gonna go with underrated. I think that there's a lot of people that have already jumped on the vitamin D train, which is great. Most people are deficient, especially in winter months. If you are from where I am, up north, but it's not just a vitamin, right? It's this hormone-like regulator for like immunity, bones, mood, like you name it. You'll find research with vitamin D supporting it. So I love it, but I do encourage testing. Like I think we should be doing baseline and like ongoing testing.
Magnesium.
Completely underrated. It's, this supporting so many things as well in the body. So like the stress mineral, our body is begging for it in so many different organ systems, sleep, anxiety, muscle cramps, digestion. Um, yeah, big shocker. It's a deficient nutrient for us. So definitely underrated. And yeah, I think it should just be part of our foundation nutrition.
How about any that you think are overrated? Because I have a feeling the ones that we have listed are all underrated, and I just have an inkling. So I'm just why don't we turn the question and see, are there any that you're like, nope, I don't think it's as important as a lot of people think.
I don't know if I would say it's not as important, but maybe I'll say personally, I'm not like on the magnesium L3 and 8 train just yet. So um I think that the research to me is like I'm not sure it's there yet. Um I'm not sure I if it really does cross the blood-brain barrier. So like to me, I would still just be given like magnesium glycinate, um, or like recommending like an IV bag with magnesium in it. So I think all mag is underrated, but I don't know if like the form of magnesium L3 and 8 is like more if I'm rated on like on par with that one yet. Yeah.
Okay. So in terms of like anything that you see on the interwebs, is there anything that comes to mind that's like, hey, this is buzzing right now, and I think that it's definitely overrated? Um, I know we had put together like a little bit of a list, and we were talking about like apple cider vinegar, fiber,
Yeah.
oil, even things
I
like
think it's just those things. Yeah. Functional foods, right? Like you mentioned it yourself, like I don't think we can get everything we're hoping to from our diet. But also in the individuals that are looking for like therapeutic doses. So I think it's great to incorporate these things, but if we're looking to actually change something or support like symptomology, I don't know if like apple cider vinegar or um like fermented foods are really going to do it for us.
yeah. So kind of going back to bring this full circle, people many times will use apple cider vinegar to support stomach acid or metabolic health. This is where we're looking at the betaine HCl, the spectrazyme. You guys changed the name now because I'm so used to Metagest.
I
But
know, I know.
supporting that directly. And then, even like you were saying earlier, these therapeutic doses, making sure you can absolutely absorb it. That's going to be that GI replenish. So, I think there's a lot of fluff out there. And obviously, we just want to say, first and foremost, if you're listening to this, this is not medical advice. You should always speak with your practitioner and provider and do proper testing. But also at the same time, recognize too, there's a time and a place for these things. What takes priority is going to be very bio individual as to where you're at in your healing process. So, as we kind of round this
Yeah.
out, I would just remind you all, as much as we love Metagenics, don't go to the website and buy the whole thing, because you might not need all those things. You need the foundations, as you talked about earlier too. So thank you so much for being with us today. As we wrap up too, just let our listeners know where they can find you on social media if they want to follow you, learn more from your world of genius.
Well, that's so nice that you asked that because I'm actually just started putting my name on social media. For the longest time, I wasn't, but they can find me on Instagram as the Vitamin Fairy. So yeah, you can see I don't have a huge following right now, but I would love all of you to follow. You can find me at Metagenics. If you're a practitioner, you have any questions, don't hesitate to call in. And then I'm thinking you're probably going to find me on this show again. I'm hoping we'll chat again because there's so many things that as we were going through some of these questions today, I'm like, you know what? I think that something a lot of your listeners would probably benefit from is just like learning about how like that manufacturing, that quality process works because I think that this is something that a lot of people are not like privy to, right? And I think it's super important because what is in theory is not actually like in reality what happens in the lab. So yeah.
Yeah. I love the vitamin fairy. Can you just tell everyone, like, where did that come from? Just curious.
100% I could. So, where it came from is one of my patients. So, I still maintain a private practice. And she's just this adorable, like 85-year-old lady. And That's what she calls me. So she loves her like SPM active. Hopefully we'll chat about that one day. And anytime she needs an order from Metagenic, she'll be like, "Oh, the vitamin fairy came." And she has her grandson. She has a couple grandsons that are twins. They're professional athletes. And at Christmas time, they ask for like a Snuggie blanket and a bottle of SPMs, right? And they're like, "Can you talk to the vitamin fairy?" So it's just this name that's happened in her family. And it's so cute, and I think it's a really good representation of a lot of things I stand for. So yeah, find me, Vitamin Fairy, on Instagram, on TikTok, and I might be a few other places. Just look for the Vitamin Fairy. It's me.